serotonin syndrome and all these type of things. And so I guess the CBD world is thinking, hey, let's take some of these things from the supplement world, put them together. We got a supercharged CBD oil that's really going to help with their anxiety, which it actually may and it could, but you also, if somebody has a medication for anxiety, they're taking these supplements without knowing what's in it, they can have some really bad side effects. So that's kind of the trend that I'm seeing. And I really caution patients when they bring me a bottle of oil, especially the ones that say they're THC free, and you're like, where did you get this? Where's the lab testing? Who is it from? Why are you positive for THC when it says THC free? Now I got to kick you out of the clinic. So it's these types of discussions, but it's just really these bad actors. Some people are doing it just because they want to help people, and some people are doing it because they just want to make money. And so I think just as this field gets more and more popular, these people are trying to get more and more money by changing their branding or changing what they're putting into the bottles, but stick with what works. So.
So one of the concerning trends I have is watching the brands and then getting into dispensaries, and dispensaries effectively becoming like doctors' offices, right? I mean, it's crazy because it's even worse than the doctor's office. The pharmaceutical sales rep going in, and trying to sell a drug. It's the same way in the dispensaries now, and it's but these dispensaries are not regulated like doctors' offices, and they're not supposed to prescribe. They're not doctors, and so the advice that the consumers are getting are from bud tenders who I don't think there's any regulation in California or anywhere of how they should be certified. So I don't know exactly what, but that's a concerning trend for me, especially as an owner of brands, that try to tailor to medical audiences, but just watching what's happening in California, at least, it's concerning. So I hope they can address this in the near future.
I agree with that. I think as a medical provider, you send these patients to some of these places and they're getting advice from these people that don't have medical degrees, but you and I were talking about earlier, sometimes these patients know more than we do. When I first started in this field, these people are coming to me and I'm like, I don't even know what you're talking about. So sometimes these bud tenders do know more than we do up to a point, but I do think that we need to meet them. There needs to be more medical providers in this space that feel comfortable talking to their patients about this. And it's very hard finding people to accept the risk of, doing the medical marijuana, and a lot of the chronic pain patients are, so I think I see why, but I also see we do need to meet that need as a medical professional too. We need to meet that need.
Or they should have a doctor on site, perhaps.
Yeah.
These guys make enough money as a dispensary.
Yeah.
Why not put a doctor on site who's an expert in dosage, in maybe looking at these THC CBD ratios to the best of our knowledge today, and who are up to speed on the latest developments on what to prescribe. The issue is even the doctors. People aren't coming to you to train you on THC and CBD like they would in the pharmaceutical industry. So it's the pharmaceutical rep's job to train the doctor on how the efficacy of their product works. And I just, that cycle is not working in cannabis yet.
I'll just add two little things about trends. One is a trend that is slowly occurring but needs to occur much quicker, and that is drug delivery systems and metered dosing. Right now it's very difficult, particularly when you're looking at inhalational type products, is as well as any other products. We talk about all these nanoemulsifications and bioavailability and all this type of stuff, but we need more ability to have metered dosing. Even when people inhale, for example, this is a perfect example. The variability of how much cannabinoids, terpenes, and things are actually being delivered through an inhalational route is so variable, because it depends upon the duration of the inhalation, it depends upon the lung capacity, it depends how long people hold their breath, and so you look at inhalers, for example. Those are an example of a metered dose, where you push the inhaler down and it's telling you it's going to deliver a certain amount of drug. With most of there are some products out there that do have quote-unquote metered dosing, but I've looked at them and they're still lacking a little bit, and I think they could be done better. And so along those lines, then you have to say, well, how is that different than the oral stuff? Well, then it comes down to bioavailability, and how are we going to ensure that what people are being given, that we're giving them the best compounds available. And then the last trend I'll just say is that I think The pharmaceutical industry is going to continue to look at synthetic molecules that target different pathways, of cascade pathways of signaling systems within the endocannabinoid system. And after going to some meetings with some of the pharma, looking at some of the pharma research, that's where I think a lot of the pharma is going to go. So I think that's where the trend is going to go. And I think cannabis as a plant, as long as we remain safe and offer safe products out there with transparency and we're not hurting people, that it's going to be left in the supplement industry in the end.
Thank you, gentlemen, very much for your time. All right, we're good to go. Thank you, guys.
Good job. No, she's not. She's down here. Most we start out with products now. We have a couple non-CBD supplements as well. Because we're really on health and wellness. It's a good formula that we produce where
It's but they have a little bit. They have a tiny bit of THC, but they smoke and it's THC free on here, but they have
Sure. Do I play any trick as well? I do a lot of counseling. Did I give you my card? Yeah, I got it. Spinal muscle atrophy. I've heard of it. Spinal muscle atrophy.